Welcome to the Deep Dive. Today we're unpacking something that, well, it affects so many of us, but it's often shrouded in confusion, maybe even a bit of mystery. Dietary supplements.
hmm
You sent in a great load of source material, articles, research, some personal notes too, and our mission today is really to cut through all that noise.
Yeah, there's a lot out there.
Exactly. We want to explore the whole picture, like where did these things even come from? What's the real deal with regulations now? What about the ethics for professionals and those interactions,
Mm,
the ones you really need to know about?
crucial stuff.
Yeah, the idea is to give you that shortcut,
Yeah.
get you well informed without drowning you in data. I mean, seriously,
Yeah.
how many of us have got a bottle of something sitting in the cupboard right now?
Oh, definitely.
And maybe we're not totally sure what's in it or like what it actually does.
It's a really common feeling. And, it's a bit like coffee. If I have one bad coffee, it doesn't mean all coffee is bad, does it?
Good point. Yeah.
So this deep dive is about getting that wider view, that sort of 30,000-foot perspective on the supplement world, understanding there's a huge range in quality, and importantly, a real lack of pre-market checks.
Okay, so to really get where we are now, maybe we should rewind a bit. Let's start with this amazing story. Back in the 18th century, apparently more sailors were at sea then than actually on land.
Incredible, isn't it?
And picture this expedition in the 1740s. They were off to raid Spanish holdings, but it just turned into a complete disaster. Almost three-quarters of the men lost
75%. Wow.
to this illness they described as having, get this, a luxury of fungus flesh and putrid gums. Men literally died before they could even reach the deck. Just horrific.
It's truly awful. And back then, the remedies people tried were, well, all over the place, often pretty desperate acts.
Like what?
Well, Captain Cook, he famously recommended malt and sauerkraut. Others were drinking dilute sulfuric acid.
Sulfuric acid.
So this-
Seriously.
Yeah. Some things seemed to maybe help a bit, others definitely didn't. And the key thing was nobody really understood why it was happening.
Right.
But then, in 1747, this young medical apprentice, James Lind, he was on the HMS Salisbury, he did something pretty groundbreaking. It's basically seen as the first proper controlled clinical trial.
Oh, interesting. What do you do?
He took 12 sailors, all sick with the same mysterious illness,
Yeah.
and he split them into pairs, gave each pair a different potential remedy,
Okay.
and the breakthrough. It happened within a week. The pair he treated with just 2 oranges and a lemon each day. They recovered so well, they were actually able to start looking after the others.
Wow. Just oranges and a lemon. So that was the big aha moment.
exactly.
This terrible condition. It was scurvy. And it was caused by something so simple, not getting enough vitamin C.
And here's a fascinating bit. Humans, primates, and guinea pigs, we're almost unique among mammals. We actually can't make our own vitamin C.
Really? I didn't know that.
Yeah, we have to get it from our diet. It needs to be supplemented. And if you don't get enough for a long time, well, you get those awful symptoms. Extreme fatigue, bleeding gums, joint pain, wounds healing really slowly, even serious heart problems.
So that discovery must have been huge. And when did we actually start making synthetic vitamin C?
That was quite a bit later, actually, 1932. That's when ascorbic acid, the synthetic form, was first produced, a real milestone.
Right.
So you see how this history, finding vitamins, realizing they prevent these awful deficiency diseases like scurvy or beriberi from lack of B1, rickets from lack of vitamin D, how that really kick-started the whole idea of vitamin supplements.
It showed that tiny nutrients could stop these massive illnesses.
Precisely. It fueled the whole development.
Okay, so that's the origin. But let's jump to today. Things feel, well, a lot more complicated now. What is a dietary supplement today, legally speaking? And maybe just as important, what isn't it?
Good question. Here in New Zealand, the official definition is actually pretty broad. A dietary supplement can be an amino acid, a vitamin, it could be a herb, a mineral, even a synthetic nutrient.
Okay.
It can be sold on its own or mixed with other things. But, and this is key, it has to be in a controlled dose form. So, liquids, powders, tablets, capsules, lozenges, that kind of thing.
Right, like a pill or a measured liquid.
Exactly. And it's always meant to be taken orally by mouth. And the whole point, it's right there in the name. It's supposed to supplement what you'd normally get from your food.
Supplement, not replace.
Correct. And what they definitely cannot be is important too. They can't be controlled drugs or prescription medicines or even those pharmacist-only or pharmacy-only medicines you get behind the counter.
Ah, okay. That distinction alone raises a huge question then. What are they actually allowed to say they do? What claims can they make?
That's the really crucial legal line they have to walk. Dietary supplements are not allowed to have a stated or implied therapeutic purpose,
No.
meaning they can't claim to, say, prevent a disease or alleviate symptoms of a condition or treat something specific. They can't claim to directly change how the human body works either.
So an example.
Okay, so saying a product supports your immune system and prevents colds and flu, that crosses the line, that's a therapeutic claim, too strong for a supplement.
Right.
But saying something like aids healthy digestion or supports joint mobility and flexibility, those are generally seen as okay. They're called health claims. It's a very, very fine line sometimes.
That is such a vital difference, especially if you're trying to figure out health info,
Yeah.
or even if you work in like health marketing. I remember being so careful with wording when I managed social media for a dispensary.
Absolutely, you have to be.
And we see these health claims everywhere, don't we? Things like lysine for, healthy lips,
Yeah.
or cranberry for urinary tract health, ivy leaf for respiratory support, kawakawa, that's a New Zealand native, right? Often used externally for wounds, boils.
That's right, though often in traditional use externally.
And then the really common ones: folic acid for a healthy pregnancy, vitamin D for bones and joints, magnesium for rest and sleep. All familiar claims.
Exactly. Those fit within the health claim boundaries generally.
Okay, so we know what they are, what they aren't, and what they can sort of hint at doing. But with so many out there, how do we get smart about reading the labels, understanding the rules?
Right, becoming a savvy consumer. Well, when you look at labels, food or supplements, there are two terms that are pretty useful to understand. First is the estimated average requirement, or EAR.
Year. Okay.
That's the amount of a nutrient estimated to meet the needs of about half the healthy people in a group. Think of it like the middle point on a bell curve.
So enough for some, but maybe not others.
Exactly. Then you have the recommended dietary intake, or RDI. This one's set much higher than the EAR. The goal is to cover the nutrient needs of about 98% of the healthy population.
Ah, okay. So the RDI is designed to be enough for almost everyone.
Pretty much, yes. And the implication there is that if you're eating a reasonably balanced diet, you might already be meeting the RDI for many nutrients without needing extra supplements.
That's a really good point. You see RDIs on food packaging too, right?
You do. It might say something like, 2 biscuits per serve gives you 50% of your RDI for vitamin B1. It's meant as a guide.
Okay. So given those definitions, what does this all mean for how supplements are actually regulated? Is someone checking them?
This is where it gets really interesting and maybe a bit concerning for some. The rules for dietary supplements in New Zealand fall under general food laws, plus animal product laws if they contain animal ingredients.
Oh.
But here's the absolute crucial point for you as a consumer. There is no pre-approval process.
Wait, what? No check before they go on sale?
Correct. Unlike medicines, supplements don't have to go through mandatory checks for safety or effectiveness before they hit the shelves. Seriously. The responsibility, the onus, is entirely on the sponsor. That's the company putting the product on the market to make sure it's safe, good quality, and follows the law.
So you're basically just trusting the manufacturer, not a government agency.
In terms of pre-market checks, yes. That lack of pre-approval is a huge difference compared to medicines. It immediately brings up those questions. Does this actually do what it claims? And does it even contain what the label says?
Wow.
Now, the regulations do set some limits. There are maximum permitted daily doses for certain things to be classified as a supplement. Like zinc, it can't be more than 15 milligrams per daily dose. Any higher, and it has to be registered as a medicine. Vitamin D has a max of 25 micrograms.
But no one's checking each batch before it goes out.
Not routinely, no. Enforcement tends to be reactive, meaning they might investigate if problems arise later.
Okay, that lack of pre-approval really shifts the focus onto the ethics of the whole industry, doesn't it? Especially for pharmacists selling them.
It absolutely does. For pharmacists, the code of ethics is paramount. Its main goal is maintaining public trust in the profession. And yes, it definitely covers advice on dietary supplements. It revolves around 3 big themes: care, integrity, and competence.
So how does that play out specifically with supplements?
Well, let's take principle 1. The patient's health and well-being must always come first. This means pharmacists need to consider the available evidence before they recommend or promote an alternative medicine, including supplements.
Like the vitamin C for colds example.
Exactly. The evidence that it prevents or significantly shortens colds is, frankly, pretty limited for most people. So if a pharmacist recommends it, ethically, they should be upfront about that. Maybe mention if the recommendation is more anecdotal, based on personal experience or tradition, rather than strong scientific proof. We sometimes call that the Scholar-Mac approach, balancing science with anecdote, but being clear which is which.
Right. Being honest about the evidence or lack of it?
Mm.
What else?
Principle 2 is about patient-centered care. Pharmacists should explain all the options impartially, without bias, using current info, and crucially, respecting diversity. Maybe someone prefers traditional Maori remedies or traditional Chinese medicine. That needs to be respected.
Okay. Impartial advice.
And then there's principle 4, honesty and integrity. This is where avoiding conflicts of interest comes in. It might seem small, but think about those subtle pressures. Maybe there's a promotion. Sell 10 of this product and the pharmacy gets a free morning tea.
Incentives.
Or maybe staff members get a free product if they sell X amount. The ethical standard is clear. Recommendations must be based on what's best for the patient according to evidence, not driven by sales targets or perks.
That's a really important, maybe often invisible aspect. And thinking about integrity, how does that apply to the products themselves? Understanding what's actually in the bottle. You mentioned labels earlier.
Yes, understanding labels is critical, especially for minerals like iron. It's not just about seeing iron on the label. You need to know the difference between the salt form, like ferrous sulfate or ferrous fumarate, and the elemental value.
Elemental.
That's
yeah.
the actual amount of the pure mineral, in this case, iron, that your body can potentially absorb and use. And this varies hugely between products.
Give me an example.
Okay, iron supplements. Something like Ferridan might be prescription only and have a decent dose, but compare over-the-counter options. Spatone liquid sachets, they contain only 5 milligrams of elemental iron per sachet.
Just 5 milligram. Okay.
Compare that to something like a ferrogradimate tablet, which can contain 105 milligrams of elemental iron.
Wow. 5 milligrams versus 105 milligram. That's a massive difference.
Huge. We actually had a real case. A patient taking Spatone wasn't getting constipated, which is a common side effect of iron. And it turned out it was simply because the elemental iron dose was so low compared to the 105 milligram tablet someone else might be prescribed. It really hammers home. All iron supplements are definitely not created equal.
That's such a clear example.
Yeah.
Okay, so linking this back, are lots of people actually taking these supplements? What do we know about trends in New Zealand?
Well, the main data we often refer to is the 2008-09 Adult Nutrition Survey. Yes, it's a bit dated now, but the trends it showed have likely continued or even increased.
And what did it show?
It looked at regular users, people taking supplements at least once a week, and it found roughly 1 in 4 or 5 guys aged 19 to 30 were supplementing regularly.
1 in 4 or 5.
Okay. And the rate was even higher for women in that age group. What's also really noticeable is a big jump in supplement use for people aged 51 and over.
Why is that, do you think?
Well, that often correlates with having more health conditions, comorbidities, chronic diseases. People might be trying to manage those or improve their general health as they get older.
And you mentioned people don't always tell their doctor or pharmacist.
Exactly. That's a huge issue for healthcare. If we don't know what you're taking, we can't check for interactions or potential problems.
So why do people take them? What are the main drivers?
Oh, there are loads of reasons. Often it's a genuine desire for better health, maybe boosting the immune system, supporting joints, things like that.
Sure.
There's also often a strong belief that natural is better or safer than conventional medicine, which isn't always true, but it's a common feeling.
Right, the natural appeal.
Cultural and family traditions play a part too. And these days, social media influence is massive. TikTok, Instagram, news articles, ads popping up everywhere.
Direct-to-consumer advertising, yeah.
People also take them to fill gaps they think they have in their diet, whether those gaps are real or just perceived.
Okay.
And then you have specific groups who often do have increased needs and might genuinely benefit from supplementation. Athletes, for instance. Pregnant or breastfeeding individuals, think about the huge increase in iron needs during pregnancy because blood volume goes way up.
Yeah.
Then that need drops right off during lactation if the mother isn't menstruating. Also, vegetarians and vegans might need B12, maybe iron or zinc. People with celiac disease might have absorption issues, or those with religious dietary restrictions avoiding, say, pork gelatin in capsules.
So lots of different motivations and needs.
Absolutely. But the core advice generally remains. If you can get the nutrients you need from a balanced whole food diet, that's usually the best way. And always remember, natural doesn't automatically mean safe.
Good reminder. And sometimes supplements aren't just about general health, they're actually recommended alongside medicine. right?
Yes, definitely. Like
Hmm.
taking folic acid if you're on methotrexate for rheumatoid arthritis, it helps reduce side effects.
Yeah.
Or taking vitamin C with iron tablets if you have iron deficiency anemia, because it helps your body absorb the iron better.
Okay.
And there's ongoing research too, like looking at whether certain supplements could help reduce side effects from chemotherapy in kids, so it's complex.
It really is.
Yeah.
Which brings us neatly to a super critical area. Things can get serious here. Let's talk about medicine-supplement interactions.
Yes, this is hugely important. The whole issue of herb and supplement interactions really gained major attention around 1991. That's when scientists discovered that grapefruit juice could significantly affect certain liver enzymes.
Grapefruit juice, really?
Yep. Specifically, a group of enzymes called cytochrome P450, which are crucial for breaking down many medications in our bodies.
Wow.
And it's important to stress, herbal supplements, usually in pill or capsule form, contain concentrated extracts. They're much more likely to cause interactions than just, say, eating the herb as part of a meal simply because the dose is so much higher.
Right, concentration matters. So how do these interactions actually happen?
There are basically three main ways. First, you can have direct chemical interactions. This is where the supplement and the drug literally bind together, changing how they work. A common example is calcium carbonate, like in some antacids, binding to a tetracycline antibiotic, which stops the antibiotic from being absorbed properly.
Okay, they stick together. What else?
Second, there are pharmacodynamic interactions. This is more about how the two substances affect the body's response. They might amplify each other's effects or work against each other. Think of ginkgo leaf, sometimes taken for memory. If taken with a COX inhibitor drug like ibuprofen, both can thin the blood, so taking them together increases the risk of bleeding.
Ah, so combined effects.
Yeah.
And the third type.
That's pharmacokinetic interactions. This is all about how the body handles the drug or supplement, affecting its absorption, distribution, metabolism, or excretion. The ADME process.
Okay, how the body processes it.
Exactly. The classic example here is St. John's wort. It's known as a potent inducer of one of those liver enzymes, CYP3A4.
Inducer, meaning it speeds it up.
Precisely. It makes the liver break down certain drugs much faster than usual.
And what's the consequence of that?
Well, take cyclosporin, a vital immunosuppressant drug used after organ transplants to stop rejection. St. John's wort speeds up cyclosporin's breakdown so much that the levels in the blood can drop dangerously low.
Oh.
There was a documented case where this exact interaction was linked to kidney transplant rejection because the patient wasn't getting enough of the cyclosporin they needed. It wasn't being effective anymore.
That is a really powerful and scary example. It really highlights the hidden harms, doesn't it? These interactions aren't always minor things.
Not at all. And some herbal products are biologically active in their own right. Take CBD, for example. It's hugely popular, but it can cause side effects like dizziness, nausea, diarrhea, even liver issues.
Right.
And what's really concerning is that CBD is known to potentially interact with at least 139 different medications and over-the-counter products. But do people always tell their doctor or pharmacist they're taking CBD? Often not. It creates this huge potential blind spot.
That's a massive number of potential interactions. So if someone's taking supplements or thinking about it, and they're also on medication, how can they find reliable information? Where should you, the listener, look?
Good question. There are some excellent trustworthy resources. The New Zealand formulary, NZF, is a key one for healthcare professionals and often accessible.
Okay.
The Office of Dietary Supplements at the National Institutes of Health, NIH, in the U.S. has fantastic fact sheets for consumers and professionals. Very evidence-based.
NIH. Got it.
For really detailed interaction checking, professionals often use databases like Stockley's Herbal Medicine Interactions. You might get access via online library subscriptions. Medicines Complete is another professional resource.
And maybe a good reference book.
Yes, a highly regarded one is Herbs and Natural Supplements, an evidence-based guide by Braun and Leslie. It's very comprehensive.
Okay, great resources. To make this really practical, maybe we can run through a couple of quick case studies.
Good idea.
Okay, case one. Let's say a 28-year-old woman comes in. She's taking Oralcon 30, which is a standard combined oral contraceptive pill. She's feeling stressed and wants to start taking St. John's wort. What's the advice?
Right. As we just discussed, St. John's wort is a CYP3A4 inducer. That specific enzyme, CYP3A4, is involved in breaking down the estrogen component of her contraceptive pill.
So St. John's wort speeds up the breakdown of her birth control.
Exactly, which means the levels of estrogen in her body could drop, potentially reducing the effectiveness of the contraceptive. There's a risk of unintended pregnancy.
Okay, so the recommendation is clear.
Absolutely. The recommendation would be do not take St. John's wort with this contraceptive. We'd need to explore other ways to manage her stress. Maybe talking therapies, lifestyle changes, social support, other options that don't carry that interaction risk.
Clear advice.
Yeah.
Okay, case 2. Mrs. Q, she's 50. She takes levothyroxine every morning for an underactive thyroid. She's been feeling really tired since having COVID-19 and wants to start taking an iron supplement. What do we need to consider?
Okay, key interaction here. Iron supplements can actually reduce the absorption of levothyroxine from the gut. They can bind together.
So the thyroid medication might not work as well if taken with iron?
Correct. The effects of her thyroid medication could be reduced. So first step, we'd strongly recommend she gets a blood test to actually check her iron levels. Is she truly deficient? Maybe the fatigue is thyroid-related or post-viral, not low iron.
Right, check first. Don't just assume.
Exactly. If she does need iron, the crucial advice is about timing. She needs to separate taking the levothyroxine and the iron supplement by at least 2 hours, ideally 4, to minimize that interaction.
Separate the doses.
Yes. And she should also let her doctor know she's starting iron so they can monitor her thyroid function tests, maybe adjust her levothyroxine dose if needed.
Great practical examples.
Mm-hmm.
Okay, as we start to wrap up this deep dive, let's pull back to the bigger picture again. What are the main challenges, the key takeaways for you, the listener, navigating this complex world?
I think it boils down to a few fundamental things. Remember, dietary supplements are not regulated like medicines. That's the big one.
No pre-market checks.
Exactly. No required pre-market safety or effectiveness checks here in New Zealand. Enforcement is reactive. They usually step in after a problem's been reported, which means products might not contain what they claim, the dose could be wrong, or the ingredient might not even be there. Or worse, they might contain undeclared substances that aren't on the label at all.
Like what kind of undeclared substances?
We've seen cases internationally and sometimes locally where, for example, sexual enhancement supplements secretly contain prescription drugs like sildenafil, Viagra, or weight loss or detox teas might contain powerful prescription laxatives like Senna or even banned stimulants.
Wow, that's seriously risky.
It really is. It just reinforces that point again and again. Not all supplements are created equal. You can't assume quality or safety.
And you mentioned the tension between business and ethics earlier.
Yes, there can sometimes be a conflict between the commercial drive to sell products and the ethical duty of health professionals to give impartial, evidence-based advice. That code of ethics is meant to ensure patient safety always comes first.
And what about reporting problems if someone thinks they've had a bad reaction?
So important. Please report it, even if it's a supplement or complementary medicine. In New Zealand, reports go to CARM, the Center for Adverse Reactions Monitoring, based in Dunedin. That's how patterns are spotted. There was a well-known case where reports to CARM identified liver toxicity associated with a product called Arthur. Reporting makes a real difference.
Okay, CARM. Good to know. So, final thoughts. What does all this mean for you, the listener, making your own health choices every day? What's the pharmacist's role, distilled down to advice for everyone?
Okay, think of this as advice for managing your own health information. First, try to keep a thorough history for yourself. Know all the medications, past and present, and any dietary supplements you take. Keep a list.
Good practical tip.
Second, always seek out evidence-based advice when you can. Ask questions. And expect your healthcare professional to be clear if their recommendation is based on strong science or if it's more anecdotal, that scholar Mac idea again.
Be an informed question asker.
Yeah. Third, always consider. Could taking this supplement cause harm? Could it delay me getting proper medical treatment I need? Could it interfere with my existing medicines? Safety first.
Right. Don't let it replace proven treatments.
And finally, understand your rights. You should expect healthcare professionals, doctors, pharmacists, nurses to follow their legal and ethical duties. Their primary responsibility is always your health and safety.
That's really empowering advice. What an incredible journey we've been on today. From, 18th century ships battling scurvy, right through to the complexities of modern regulations, tricky ethics, and those vital interactions. We really hope this deep dive helps you feel more informed, more confident, maybe a bit more critical when you encounter supplement claims.
Absolutely. And maybe a final thought to leave you with. In this world that's just brimming with health choices, so many products, so many claims, what does well-being really mean for you personally? And how can you make sure the choices you make for your health are truly built on solid evidence and not just, persuasive marketing or compelling stories?
A really powerful question to ponder. Thank you so much for joining us on this deep dive. Keep asking questions, keep learning, and stay curious.